session this evening. Welcome to our talk on transforming healthcare with applied positive psychology. I'm the director of the Master of Applied Positive Psychology program here at PCOM. And when I was thinking about what of my most positive interactions with healthcare providers, doctors, physical therapists, what have they left me feeling? And I keep coming back to a few ideas around feeling more empowered, feeling connected, feeling listened to, feeling a sense of trust and well-being, and increased motivation to take care of my health. I had torn my my calf muscle playing tennis, and pretty severely, and the rehab process was pretty intense. And my physical therapist ended up leaving midway through to go to another location. And it was because I felt so safe, connected, heard, in great hands with her, feeling like, you know what, I'm going to get through this injury and I can actually get back out in the court at some point. I followed her to a much further practice. And it's that kind of environment when we talk about positivity in healthcare, when we talk about how do we think about human flourishing and becoming our best possible selves, being more resilient. That's where it lies. It lies within us, within our experience of that relationship. And I am so happy to be joined this evening by Dr. Eric Langenau. And he is not only a wonderful colleague, he is a champion of positive psychology, a part of our MAP program. And I just want to turn the microphone over to you, Eric, so that you can say hello and just offer your opening thoughts on why are we doing this talk tonight? Why is this important to you?
Great. Thank you, Dr. Glassman. First of all, you did mention that, that I am a student in this program and I am a huge fan. As you said, like healthcare is getting to the point where, we need something additional. And as an osteopathic physician, I have additional skills to take care of my patients that other clinicians might not have. But also positive psychology is yet another tool that we can use to engage our patients, our students, the colleagues that we work with for leadership skills. So I am a big fan of applied positive psychology. And thank you, everybody, for being here. And I have to call out Dr. Yeager, who is actually one of my mentors from when I was a medical student, and really convinced me that being a physician includes being a lifelong learner. And he instilled that in me as a young medical student, and me coming back to take another master's program is I think, a testament to that. So hello, Dr. Yeager.
Thank you. That's where I logged on. I want to see what happens to our distinguished alumni.
Oh, well, thank you.
Thank you. Good luck.
And
back to you, Scott.
Yeah, and that also speaks to the idea that we're going to talk about positive psychology and clinical education. So not just as clinicians working with patients, but as clinician educators, and how we can use positive psychology to become better teachers, form closer connections with our students, and to really go on that journey side by side, looking out into the landscape of what could be together. So I'm really excited to get into it. And just a couple of things about me. I am a psychologist. I've been with PCOM for the past 10 years. I was working with a master's in mental health counseling program. And I've always had roots in positive psychology. As an undergraduate at Penn, I worked with Dr. Martin Seligman, who's widely considered the founder of positive psychology. Worked on the Penn Resilience Project, where we taught middle school students in West Philadelphia cognitive and behavioral resilience skills. And I really loved it. I love the idea of being proactive and taking a preventive approach. So before somebody becomes depressed or suffers from a trauma, can we equip them with the tools to be able to navigate those waters more effectively, and so that it doesn't have as much of a negative impact in their lives? In 2017, I developed a program called A Happier You, which is a multi-component positive psychology program that helps people find more joy, meaning in their lives through a variety of positive psychology pathways, gratitude, personal strengths, a lot of what we're going to be talking about tonight. And the program began as part of a grant from Independence Blue Cross Foundation. And it began with patients in our healthcare centers. And so positive psychology was really a new way we were delivering this in our healthcare centers as part of their primary care services. Like, how exciting is that, right? That you can come in for your annual wellness visit and at the same time get the kind of annual wellness boost from a positive psychology program. That's what we had envisioned. And it's since kind of expanded. A book came out on it this past November, last November, rather, 2021. And that's been all part of my professional identity, in addition to motivational interviewing, which is what we're also going to talk about this evening. How do we help people find the importance and confidence in themselves to make healthy changes in their lives? And it's all kind of circulates around the center of a lot of positive psychology models and concepts. Mindfulness is also, the last thing I'll say about myself is mindfulness is really important to me. It's been important to me as a student, a graduate student, learning from Dr. Zindel Siegel, who published Mindfulness-Based Cognitive Therapy. It's a deep part of my personal practice, as well as a part of what we've integrated into A Happier You. So all of that bears on health and well-being. So over to you, Eric.
Great. All right. Thanks, Scott. So as I mentioned before, I am a student of this program in the Applied Positive Psychology program. I currently am employed at PCOM as the Director for Teaching Support and Professional Development. I'm also the Chief Academic Technology Officer. So I help faculty really utilize leverage technology to engage students, either online or in the classroom. So being part of this online course has helped me in that regard as well. I'm also a pediatrician, professor of pediatrics, and I've been an educator for a long time in serving in a number of different roles. And it's really great to see the people who are on this call, because a lot of you I've worked with in different times of my past. So it's really great to see everybody here. So in my past, I also was a residency program director, and I did work for the NBOME. So without belaboring too much, that's me.
Yeah. And so, Eric has also been a champion of this program and the development of this program. We're currently in our first year, the Master of Applied Positive Psychology program. And I would like to tell you a little bit about it. We have a section on the program a little bit later in the presentation, but if you're eager to know more about it right now, as you might be, why bury the lead, right? So the first thing I'll tell you about it is there's a lot of misconceptions around online learning. One of the misconceptions is that you don't form close connections with others, that it's like in a box. So you're just logging into a message board that's really non-interactive, and it's really all asynchronous. And we have developed a unique program combining live elements, synchronous elements with some asynchronous elements. And our cohort is incredibly close, incredibly supportive of one another, and learning together, helping each other learn about flourishing. And we take a biopsychosocial approach to positive psychology, looking at the interaction of mind, body, and spirit, looking at positive development, positive emotions, mindfulness, diversity, systems and institutions. How can they function better? We'll be focusing on healthcare. But when you think about education, when you think about politics, the larger symbiotic systems in our world, how does positive psychology play into transformative processes within those systems? It's very important to our program. We include a lot of elements around clinical health psychology. I mentioned motivational interviewing, and that is a practical skill that you learn through the program. It culminates in a thesis where you develop and implement a positive psychology intervention of your choice, research backed, and it really speaks to balancing scholarly and practical approaches to well-being and flourishing across the year. And you'll learn group facilitation skills. And you get to do that with patients in our healthcare centers. And here is a recent picture of our some members of our cohort on a Zoom call. And you can see by their faces, they are intently learning and enjoying what they're doing. Eric, do you have anything else you'd want to say about our very brief intro to MAP? We'll come back to it later, but.
Yeah, nothing to add right now, Scott. Thank you.
Great. And if you're interested in applying or learning more about the program, here's our QR code. Jonathan is also going to put in the chat window the link to the MAP program, so you feel free to read more about what's involved and see the curriculum. And if you have any questions, you can certainly get in touch with Dr. Langenau or myself, or Jonathan Cox from admissions.
All right, one of the things I wanted to really emphasize is how aligned positive psychology seems to be with osteopathic medicine. Now, whether you're a DO or not, because I know there are a lot of clinicians on the call tonight who are not DOs, I think you would still appreciate the holistic nature of positive psychology and its relationship with mind, body, spirit. But I wanted to really focus on some of the tenets of osteopathic medicine and how they are truly aligned with positive psychology. The first of the osteopathic tenets is that the body is dynamic and functions as one unit, and that's where separating the mind and the body is sometimes not possible. They obviously influence each other. That aligns well with that first tenet. The second tenet, that the body has an innate ability to heal itself. We do that in positive psychology as well, something called strength spotting, where you identify things that you're particularly good at and use those strengths to thrive, to really leverage your strengths to work with people, to work on projects, to engage. So that power from within really is very osteopathic. That structure and function are interrelated. Again, that's the idea that the mind and the body are linked, but even evidence from neuroscience is really showing that stress can influence the amygdala, for instance, and neural pathways. Well, that's part of positive psychology as well. And the last of the tenets is that treatment really focuses on these three other principles. So if we can use some elements of positive psychology and apply it, we'll be able to help others, help ourselves, help our colleagues, help our patients, all of those folks thrive and be the best that they possibly can. So it just struck me as I started this course, this program, how aligned it really was with the osteopathic principles and tenets. It really struck me as an important piece.
And I would just add to that when you look at the literature on the patient-centered relationship, just the connection that a patient and provider have with one another, if that's very strong, there's evidence that will affect health outcomes. And the effect size is on par with, it's about 0.16 in one study that looked at it, which may seem like a small effect size, but it was the same effect size as aspirin had in preventing myocardial infarction over 5 years, which is really, it's an amazing connection. And I think the more that we can embrace the osteopathic stance, the attitudinal stance, and seeing that mind, body, and spirit are a synthesis. It's an interacting system that can affect how we connect with one another. We stand to gain greatly and really improve what those brief interactions are like, because they really do make a difference. So I want to talk a little bit about gratitude interventions. One of our first, and thank you. I want to also thank Bill for your comments in the chat, recovery language makes a difference, right? So how we frame a sense of our feeling towards a patient, like in terms of how we see them, right, from an empowerment perspective, from a hope perspective. If you have a comment, if you have a question, please drop it in the chat window and we'll be thrilled to answer it for you. Gratitude is one of the emerging areas of research in positive psychology, which is increasingly linked to happiness, linked to lower levels of depression, lower levels of anxiety, increased resilience. And looking at how does this play into healthcare? Well, workplace gratitude interventions, when they examined them among physicians and nurses, were tied to emotional exhaustion being reduced, lower levels of depression, increased job satisfaction. And we've just come through a pandemic where emotional exhaustion, depression, low job satisfaction, burnout, all of those, that constellation of factors really speaks to how gratitude could play into how we now entering this post-pandemic phase can bolster our workplaces, where the stress levels are still, they remain high. We still remain in a pandemic phase. It's different now, but there's still definitely a threat out there. When they looked at these workplace gratitude interventions, 82% of respondents felt like it was important to receive written recognition, so written expressions of gratitude, and that the peer-to-peer gratitude expression between physicians, nurses, and staff, that was associated with increased patient satisfaction. So when we are expressing care, appreciation, kindness toward each other as providers, our patients benefit. Why is that? I think because we're changing the whole culture. We're changing the whole environment. We're changing our positive emotional valence, our threshold for being able to be higher energy when we walk into the exam room, feeling like we have more reserves to help a patient think about what they're going through, to learn about them. When you look at really tough environments, 88% of long-term care nurses who gratitude journaled, and they only did it for about 15 minutes a day, which, I think we all can do something for 15 minutes a day, I hopefully for self-care. When they were doing it for 15 minutes a day, not only did they feel it was beneficial, but they were impacted from the sense of the culture of continuing beyond the study. So they continued to do it. They continued to bring it into that environment. And so it's not just between providers though, right? It's also between patient and providers. We hope that our patients will share what they appreciate about us and about the services. And when that happens, when there's a formal structure around that, providers tend to feel more pride, a greater sense of well-being, motivation, lower levels of burnout, even spiritual growth. So that, again, we're talking about the culture of gratitude, the culture of positive psychology from this one particular wavelength. So what could be a few gratitude interventions? I'd love to hear in the chat window if you have a thought about which one of these gratitude interventions strike a chord. Which one might you bring back to wherever you're working? Could it be a workplace thankful event where you encourage patients to thank their providers and providers to thank each other? Could it be a gratitude journaling experiment? Could it be just a simple peer-to-peer Post-it note exchange? Could it be thanking your healthcare provider of the month, right? Could it be starting meetings with appreciation for work done? Can we change ourselves from being task-oriented into being more person-centered, looking at each other from through a holistic lens, despite the system pressures that pull us away from a gratitude perspective? Anything, Eric, that you'd like to add about gratitude and the way you feel maybe touched by it in your work?
Yeah, I think you hit a lot of the important pieces, especially for clinicians, because I know there are a lot of clinicians on the call tonight. But, in healthcare, we're constantly bombarded by messages from patients, from callbacks, from referrals, from prior authorizations, from, delays, all kinds of different things. And it's easy to lose sight of why we went into a profession where we care for other people. And so looking at gratitude, whether you do a formal journal or you're just mindful of what patients provide you as a clinician and what we can provide our patients, is a form of gratitude that can be really invigorating. And just by spending a moment to really think about that, I have found that it really helps me recenter and remember why I went in to take care of patients in the first place. It's so easy to get distracted and so easy to get burned out, but that gratitude, that two-way gratitude, man, that goes a long way. It's really neat.
And that values center can be so reinvigorating when we get in touch with what we care most about each day and link that with our decisions. One of my personal practices is writing down at the beginning of the day what my key values are. And I'm not always looking at what I need to do to satisfy those values. I'm just having them be present in my awareness. And by the end of the day, I look back to see, what did I do today that really was in line with my values, whether it's creativity, helping others, positive psychology. And there's such a sense of mission and purpose that drives for me personally, that I love what you're saying about this, Art, because I think the more we can look at the why, the more we're able then to find the reservoir of gratitude, the reservoir of kindness, the reservoir of the energy that we have to help our patients in need. So another area of positive psychology that can be helpful for us is thinking about personal strengths in healthcare. I mentioned values, and oftentimes values in action, when we put what we care most about into our day, our schedule, activities that really allow those values to come forward, they become personal strengths. And one of the other things that we know about burnout, one of the key dimensions is a low sense of personal accomplishment. And the Maslow burnout inventory, which was one of the most popular burnout inventories that was constructed, low personal accomplishment is central. And when we look at how can we help healthcare providers and even our patients access their personal strengths and build their strengths more readily. In one setting, they used simulations. So they had simulations of emergencies, and the providers who went through these simulations in a low demand setting, they're virtual, right? Found that they had increases in assertiveness, felt more prepared, developed a greater internal locus of control. So greater sense of being empowered, as well as an internal locus of responsibility, like wanting to take on more responsibility and feeling capable of that, were strengths that really were increased by developing these run-throughs, these kind of rehearsals. And the other element about personal strengths in healthcare that makes sense to look at is the idea that when you use your strengths in new ways, that can be associated even more with increased happiness and lower levels of depression. So for instance, if your strength is curiosity, and curiosity is one of those strengths that's especially tied to well-being, if you're learning something new in different areas each day of the week, or three out of the 5 days of your work week, then you might be more likely to feel happier, to feel more a greater sense of purpose and meaning, and feel more invigorated. So we really would like to help folks pay attention to their strengths. And so here's one of the practices that may be useful for you when we talk about applied positive psychology, like we do in MAP. This is one of the exercises that we talk about. So if you pick one of your highest strengths, and you can go to viacharacter.org and take a survey, and it will list from 1 to 24 your top character strengths. And you think of a new way or context that you can express that strength each day, and the different situations you could choose from. And maybe it's at work, maybe it's a hobby with your friends, parents, or children. Doesn't really matter where the situation or context is, and implement that strength in a new way, and then looking at its effect on your mood. So that's one of the exercises. That's one of the practices that develops that, that, as we call it, kind of happiness muscle, the positivity reflex, which can be something that helps us when we're faced with high demand, high burnout related situations. Again, Eric, I want to turn back to you. You know, as a pediatrician, working with families, working with kids, what do you think the role of personal strengths is in your work, and when you see families entering healthcare environments, primary care, pediatrics, where does that come in, do you think?
I think for me, it comes in two pathways. The first is functioning really as a cheerleader, especially those new parents, that first newborn visit. If they're new parents and they may not have grandparents or their own family in the area, they're nervous. And so they're looking for advice. They're looking for some tips, but more what they really need is somebody to back them and say, hey, you can do this. Like, you're doing a great job. You're bonding with your child. And, this is the beginning of a long relationship, beautiful relationship. And the more positive you can be and the more encouraging, that goes a long way. And when patients leave that office for that first visit, they feel empowered, that they can take good care of their newborn child. So that's one side I see. But I'm also, like many of the people here tonight, a clinical educator. So I almost always have a medical student at my hip. And sometimes the students are struggling and they may confide in me that they're having a hard time with the concept. And a lot of times it's the same type of thing. You have them identify their strengths. What are they good at? What do they really excel in? And leverage that so that they can succeed, rather than focusing on the things that are holding them back. And I found that that's a very good way to really build their confidence, because a lot of times, the weaknesses can be overcome by other strengths. But if you give them enough confidence that they believe in those strengths that they have, that is very successful. So those are the two pieces I see strengths coming in as a clinical educator, but also as a clinician too.
And Bill said in the chat, picking up on that when we look for strengths and scan for them on a regular basis, on a habitual basis, then it becomes more automatic. And when it becomes more automatic, then we're more likely to kind of teach in that way. We're more likely to see what's going well with somebody versus what's wrong. And that's the whole basis that positive psychology was built on, the fact that in medicine, in psychology, in healthcare, the tendency is to diagnose the problem. What's the problem? How do we fix the problem, versus seeing how can we enhance existing strengths. And so that is a paradigm shift that also dovetails with what is the habit that we can develop to support that. And so one of the other pathways we wanted to mention this evening is kindness. Kindness as a transformative principle, potentially in healthcare settings. And we can look back to burnout, because I think this also answers a question around what do we do when we feel like we have empathy fatigue, compassion fatigue. And this is a phenomenon when you feel emotionally drained, that you feel you disconnect from that helping instinct. And there was this one study that was really powerful, and it took place in a pediatric healthcare setting where staff and parents watched 8-minute videos of kindness, just examples of kindness. And afterward, they reported, compared to watching 8-minute videos of some neutral material, they felt happier, calmer, more grateful. They were less irritated. They were more inspired and more generous. And that was just 8 minutes. You think like, well, we need these positive psychology interventions to be portable. We need them to fit within busy settings. And I think really this is a nice example of how a little goes a long way when it comes to sparking a sense of empathy, warmth, connection, wanting to help others. And we can do that through the media. We can make social media our friend in that perspective. So in thinking about kindness as a transformative principle, There was a model by Campling that looked at this idea that our systems are sort of set up that in a way that where kindness is low down in the pecking order, because the demands tend to be for commercial success. They tend to be on they're task-driven environments. And so what we need is kindness to become more of a directed attentiveness, which helps us become more attuned. So it's intentional, or what they call intelligent kindness, versus something that's like an add-on. Oh, well, I was kind today, as like something extra, not something extra, but something central that we can build, that we can use it as a basis for increasing trust between providers and who we're providing for, who we're connecting with. And that produces better outcomes. Kindness derives its meaning from the word kin. And when you think of the word kin, what do you think of? It's family, right? So can we have more of a family feel in medicine? Family practice, right, is kinship, is kindness. Again, Eric, I'd love to hear your perspective on this. Anything that you'd like to add?
Well, I also think of, the dynamics in the workplace. A lot of clinicians are viewed as leaders, whether you own your own practice or you have a leadership role in a hospital setting. Regardless, you're considered a leader, a physical therapist, a psychologist. People look up to clinicians. And a lot of times the clinicians can set the tone for the entire office, for everybody that surrounds them. So if you think of like somebody that you admire, and professionally admire, likely they're kind. Not only are they good and they're effective, but likely it's a kind person. And by modeling that, by being kind to others, encouraging other people, you build up people around you. And that builds the organization, that builds your office, your clinical setting, your workplace. That kindness really goes a long way. It's very difficult to measure, but it's there when you see it. And anyway, so that's one thing I thought of, especially with this model, Scott. It really reminds me of something you would see in organizational development, how a business model can be effective within an organization. And certainly applies to positive psychology.
And it really speaks to the availability of kindness, right? That we may underestimate the availability and the impact of kindness. It makes me think of that quote from the 14th Dalai Lama, said, "Be kind whenever possible. It's always possible," was the follow to that. So now we're moving from gratitude and personal strengths, evocation, from kindness into a way of being with people that incorporates all three. And that's motivational interviewing. And it's really a person-centered conversational style where you're using a lot of active listening, open-ended questions. You're being curious about somebody's experience. And then you're reflecting back to them what you think it's like to be in their shoes. And just this way of being with somebody helps them become more ready to make positive changes. You're helping them articulate their confidence in making a change and the why that Eric was talking about. When the why and the how become possible, become in the front of our awareness, change happens much more readily. And it's empowering. Motivational interviewing is something that I've been trained in as one of the first clinical skills that I learned as a psychologist, as a psychology student. And it really is a powerful way to set the foundation for empathy, kindness, and a strengths-based approach. One of the things we'd like to say in motivational interviewing is that the patient is an expert in themselves. They are an expert in themselves. So, wow, right? Doesn't that remove a little bit of the pressure from you to have all the answers when somebody's looking to make a difficult change? Let's say somebody with type 2 diabetes who thinks that mountain of changing diet, exercise, managing their blood glucose levels is insurmountable. Helping them find the answers within themselves, within their past obstacles overcome, is really what this way of being is all about, and something that we teach in MI. And Eric, you were especially moved by some of the metaphors and ways of talking about this way of being. I'm wondering if you could share those with us.
Yeah, this quote that you, or this paragraph that you have up here in particular, was one of the quotes that was shared, I believe, in your class on motivational interviewing. And when you read it out loud to me, it really struck me as being very, again, osteopathic, letting the patient do the work, because a lot of the motivation has to come from within. We can't impose that on patients. It's a conversation between the clinician and the patient, and we're trying to allow the client, the patient themselves, to strengthen their own motivation and will to change. And this quote really sticks out in that way. I don't want to read it out loud, but there, one piece in here, the second paragraph in particular, that if you're confronted with a whole mountain of rocks and you're trying to move that this clinician had realized that I don't have to worry about removing all the rocks. I just need to remove just a few of them, not add any more water on the top or any more rocks on the top, then get out of the way and let the water do the rest. That is really coming from within. That motivation to change has now exploded outward, and the change will be much more effective and longer lasting. So that motivational interviewing sort of approach, or that metaphor, is really a great one for me to remember.
And it's culture changing as well. When you train somebody in motivational interviewing in, let's say, a primary care practice, and they are then using a lot more reflective listening, a lot more open-ended questions, a lot more affirmations, seeing strengths in others, that filters through the whole staff dynamic. And so we can affect this kind of consistent shift toward patient-centered care through motivational interviewing that focuses on strengths and best self. And I love that analogy too, that take out a rock from the wall, let the water flow, and get out of the way, right? Allow the patient's own change process to pick up steam and momentum, and they can do it themselves. And I love that empowerment perspective. Bill had mentioned the recovery orientation. My dissertation focused on motivational interviewing and how it connected to hope, empowerment, and meaning. And it really is a source when we can be with people in these ways.
Yeah, so I think clinically there are a lot of areas where motivational interviewing has been shown to be effective, and a fair amount of research has been done to demonstrate this in terms of improving physical activity, weight reduction, blood pressure management, reduction of substance use, medication compliance, hemoglobin A1C levels in patients with type 2 diabetes, just improving self-care in general, but specific to certain populations like those who recently sustained a heart attack or congestive heart failure. And also, something as common as improved sleep in children. Sleep hygiene is becoming increasingly recognized as a problem in children that might actually be misdiagnosed as ADHD. So if you can address sleep hygiene with motivational interviewing, it can really be quite effective. So a lot of opportunities here, and these are all common things that we see in practice. You can't pop a pill for these kind of things. You really need to work with the patients and work with the families so that they can make the change themselves. So our job is to really have that conversation with our patients and families, and let their own motivation sort of rise and change behavior. And that's where motivational interviewing is really quite effective in the patient context.
Yeah, and Kelly mentioned in the chat that there's inspiration there to maybe use this with faculty, not just with students in an educational format, but also to help motivate improvements in the quality of education. So we'd love to pause here and see, what questions do you have for us? What did this conversation bring up for you? What can we answer for you? Feel free to open your microphone and just jump into the conversation, or if you feel more comfortable in the chat, you can do that too.
Yeah, hi, Abe Yeager. I happen to be a psychologist by training, a 45-year career. I retired twice. Not a question. I really want to commend you for really modernizing something that perhaps has its roots in the original intention of humanistic psychology. Because from the classical theoretical frameworks, that was the only one, sort of Maslow, Rogers, that had a more of a positive spirit, but it didn't have the empirical basis, integration with healthcare, primary care. And I remember Dr. Seligman's research originally was pure experimental with dogs and learned helplessness. And he too moved from that pathology focus to optimism, learned optimism and positive psychology. So what you're doing is modernizing with empirical anchors, and it's just fascinating to interface. So I really want to commend you. That's really my comment.
Yeah, and I would say, Dr. Yeager, it even goes back further, probably to the era of Maimonides, focusing, all the way back before the humanistic approach to psychology.
You mean Maimonides the philosopher, not just the hospital?
Oh, correct. Yes, Maimonides, the scholar, the clinician.
Yeah. Just for the record, he lived from 1135 to 1204, so this goes back a while.
Sure does.
Thank you.
And I want to acknowledge Bettina's comment that it's important the organizations value are some of the draining tasks of being a provider, like EHR. If you've ever had EHR frustration, alarms going off or notifications that seem superfluous and seem like they just are meant to drive us a little batty, that we can change technology to be more humanistic as well. Turning off those alarms might be a good example. So thank you, Bettina, for your contribution there. What other questions or thoughts or comments did you have? And so we want to just move into talking about how math could be helpful. And again, I'm going to hand the microphone back to Eric to talk a little bit about leadership and healthcare education, and where does a positive psychology degree fit into that potentially?
When Scott started this program, when he conceptualized it a couple of years ago, I immediately started thinking about relevance to myself as a pediatrician. What type of tools could I bring from the applied positive psychology to help primarily my adolescents? These poor kids maybe they're not clinically depressed, but they're not thriving. They're stuck, and some of them really need just some encouragement, some motivation, some cheerleading to kind of get them over a hump and realize they have a lot to offer as a human being. And so what could I take from this program and use in a clinical setting? And, not only just behavior and sort of motivation, but also specific actions like any lifestyle changes that they want to incorporate. But that piece was really important to me when I first started looking at this program as a potential student. The other part that really stuck with me was the relevance of being a health educator. I work with a lot of students and a lot of residents in the past, and a lot of younger attendings as well. A lot of times, it's empowering and coaching and cheerleading for those folks to kind of help them realize what they're capable of, to kind of build them up so that they can be the best that they possibly can be. And as a health educator, again, I really saw the relevance of this program and this discipline being able to help me. in terms of leadership, same thing. One of my jobs at PCOM is to develop professional development programs. And a lot of times the programs can be outstanding, but unless the horse comes to water, it's not going to be effective. So my job is to try to get people excited about professional development, about new approaches to learning and teaching. So I thought, gosh, this program could really help me in that regard as well. Just getting a different perspective, a different angle. And as Scott said earlier, with strengths, one of my strengths is curiosity. And I like learning. I always like new perspectives, and that is definitely helping me. This program is definitely helping me in that regard. And then just new relationships. It's a totally new approach. It's a new field for a lot of people, and bringing this to the attention of clinicians in particular is, I think, really, really valuable. To have people start to realize, hey, wait a minute, maybe this is something that can help me as a clinician, as an educator, as a leader in a lot of different ways. And then the thing I didn't put on here is that it's also helped me be a better scout leader. I'm a scoutmaster. I've been doing that for about, I've been in scouting for now 15, oh my gosh, it's longer than that, 18 years. And then I've been a scoutmaster for a number of those years. And a lot of times I'm working with kids who again, you need to build them up, give them some confidence, identify their strengths so that they can thrive within scouting and outside of scouting. And so that's another perspective that I thought this program would bring. And all of these have been true. The being part of this program has not been disappointing at all. And I really am very, very proud to be here as a student. And as Scott said, I am a champion of this entire program and this profession. I think it's wonderful.
And it speaks to thinking about how leaders today have a responsibility, if you think about it, to integrate principles of positive psychology into their leadership. If we look at the headwinds that we're facing from a social perspective, from an economic perspective, political division perspective, that coming together, unity, a sense of what's going to help us flourish as a global society becomes something where we need the tools to do that. And that's why I get so excited about the Master of Applied Positive Psychology program and other programs like it. It's because it begins to answer that question. Who do we want to be? Who do we want to be in this world, and where do we want to lead the world? So, and it's a bigger question. And it can begin, if you look at our course sequence, everything that we've spoken about tonight is embodied in the courses that you take over the year, from our motivational interviewing class that I teach in the fall to our mindfulness course in the winter, which is taught by my mindfulness instructor from California, one of the founding directors of the University of California, San Diego's Center for Mindfulness, Steve Hickman, looking at positive development. So how can we be more positive parents? I have a 13-year-old, and I'm constantly thinking about, all right, how can I nurture the best of who he is in such a critical time in his life? Research methods, if you're interested in the scholarly side of what we've been talking about, how do we critically evaluate what comes out of from our scientific base? And then looking at positive institutions and systems, how do we transform our schools? Bettina mentioned teachers and our schools. How do we encourage our kids to be strengths-based? How do we change our healthcare system, like we've talked about tonight? There's a practicum built into the program in A Happier You. So you get to learn A Happier You. You get to facilitate it. And you get to think about it also from a personal perspective. So one of the things I like to think about the MAP is that it is also a personal journey. Like, we're never done growing. And I've loved to see how everybody in this cohort has evolved in positive ways because of the self-reflection that they're doing. around whether it's tracking their strengths for the week or implementing a gratitude approach from the program or laughing more. We have a week on lightness and humor and playfulness and getting back into child's mind. All of this works together. We can't be professionally nourished if we're not personally nourished. I truly believe that. When we think about work-life balance, that is embodied into this program. Starts at 5:15. People can keep their jobs and then come to our program in the evenings, 3 nights a week for an hour and a half of live instruction. And then there's that asynchronous part too. You get to use motivational interviewing. You get to learn about it in my course and then use it in a group setting with patients from our healthcare center who are making healthy lifestyle changes. We have Wellness Wednesdays, and today was a Wellness Wednesday. And we had our virtual group meeting, and we focused on strengthening relationships in the new year. And it was a wonderful meeting. Two of our MAP students were co-facilitating for the first time. Very exciting to see them take the wheel, and they did a phenomenal job. So really exciting to see that you build that practical base, you build that skill set as you move through the program. Our faculty, I couldn't be more proud of our faculty. They are all experts in their areas of positive psychology and wellness and mind, body, spirit interventions. I talked about Steve. Dr. De La Porta studied with Sonia Lyubomirsky, author of How of Happiness. Dr. Kurzina has an integrative health practice that's really thriving and growing. Jennifer Corey is a therapist who works a lot with trauma, and she's also a MAP graduate, and so she integrates positive psychology into her trauma work. And Dr. Sizemore studies positive psychology in mobile apps. Right? Wow. Like, think about transforming technology and picking up your apps that have been constructed from a thoughtful perspective around gratitude, personal strengths, lightness, all of the things that we've been talking about. She spends her time at Rutgers as an adjunct there, really centering around how can we do that. And our students are involved with her research. So there are research assistants coming from MAP into Dr. Sizemore's work. So I couldn't be more excited, more thrilled about the quality faculty that we've assembled. Classes begin mid-August, so we have rolling admissions. If you're interested in applying, please send us your application. We'd love to get to know you. There are a few prerequisites. So intro to psychology. You take intro to positive psychology in our program. We don't need that as a prerequisite, but statistics and research, intermediate or an advanced psychology course, those are important prereqs as well. Jonathan just put a link to the MAP page again in the chat window. There is no GRE requirement. Phew. Right. So if you're worried about the standardized test hurdle to get over, there's not one for our program. We really want to see that you're excited about this field. That's primary area number one. We want to see that you've been successful academically. We also want to see how you want to use this degree. And there's a number of ways that you can do it, whether it's amplifying your work in healthcare, whether it's starting a life coaching practice on the side, if you have a side hustle that this could really inform. If you're interested in yoga, there's so many different ways. If you're in leadership in any capacity, the MAP degree will, I think, take your leadership work and your organization. Think about organizational change to a whole new level. So it can be really advantageous that way. I won't talk about since we're at the end of our time this evening, about any of the other requirements. You can read about those on the website. But I want to open it up to any questions, comments. Don't be shy. Open your microphone, share. What did this leave you thinking about? Like, where do you want to go from here? From this evening, maybe if it's something like very small, what's one small positive thing that you might do as a result of listening to Dr. Langenau and myself?
I'll chime in. Well, one, I have to restart my gratitude journal, but I did want to actually share that probably 8 or 9 years ago, I'd just kind of gotten into gratitude journaling, maybe 10 years ago or something like that. And at work, I ended up creating a shared Google Doc. and I would send it out every 2 weeks with some sort of positive message to the entire employees of the com. And we created basically just a shared gratitude journal. And what I think was really awesome about it is then you got to see what other people were writing and go, oh yeah, I'm grateful for that too. And it really did kind of help change the culture. I thought that was pretty fantastic. So sometimes when we get stuck and we can't figure out what to be grateful for, just reading what other people are thinking, I think is also really helpful. So I thought that was a fun idea. So we did that for a couple of years, and then I think I got busy and priorities changed maybe, or something like that. So it wasn't like part of any role that I had. I just decided to do it. It wasn't like.
And that's such an honor if you're inspired again to restart that journal
Mhm.
because of
Yeah.
this talk.
Yeah.
That is fantastic. Thank you so much,
Yeah.
Kelly, and really,
No problem.
really excited for that. You know, gratitude is so powerful. A little goes a long way, right? It's that principle of just noting that one thing from your day that feels really, that you feel really fortunate for.
Yep.
Yeah. I want to say hello to Heidi. Hi, Heidi. I know Heidi from our connections through LinkedIn and through connecting about positive psychology. Do you want to, any thoughts that you have? I don't want to put you on the spot, Heidi, but I'm just so glad to see you here, and I'm happier just seeing your happy face. So.
Oh, thanks so much. I'm glad I was able to make it. I'm here more as a spectator. I'm currently a graduate student in positive developmental psychology, which is how Scott and I got connected. And I'm really inspired to see how the field of positive psychology is being implemented in the medical field. I think this is very exciting, very needed, and it sounds like you all have a craving for it as well. So speaking not as not a clinician, it's been really informative to be here this evening. Thank you for having me.
Yeah, thank you. Thank you for being here. And, you know, there are many frontiers, right? There are many frontiers of what we're doing. And you have a specialty in positive developmental psychology, which is incredibly important. I think parents and schools just craving this idea of, you know, how can we be more effective in bringing our next generation up in the way that is going to be nourishing, you know, for our world, for our society. Yeah, any other thoughts, comments, questions? I do want to put, Eric, if you could put your email address in the chat window, that would be great. Please feel free to reach out to me or Eric if you have any thoughts about positive psychology, thoughts about ideas about ways we can innovate in this area. We'd love to hear about it. Any questions about the MET program? I'm super excited to talk to you about that and to grow and to, you know, hopefully you'll become in whatever way possible a part of our mission here at PCOM. We're really thrilled to see where it goes. So thank you. Thank you, everybody who you came tonight and you devoted a lot of time to this. So we appreciate it.
Great. Thank you all for coming.